All right, recording. Glad y'all could make it. Man, it's cold in Nebraska. Oof, what is it, like 3 degrees out right now? So hopefully everybody's warm and just appreciate y'all being on here tonight. Let's just start with anybody have anything they want to share tonight? Hi, Michelle. Anybody have anything they want to share tonight? Any wins going on for you guys? What's happening in life? I had one and now I can't remember. So give me some time to think. Somebody has to go. Somebody else has to go.
I'll
Well,
go.
oh,
All right, not everybody at once. Woo!
Well, I got to go into work a little late, but I decided to spend the night at the property. So I'm just grateful that I made it to the property and I'm going to hang out here tonight.
Oh my goodness.
So there's lots of there's a really bad semi accident right before I got into work. So
ooh,
that's not fun, but
oh,
hopefully they're safe and
Yeah.
yeah,
wow.
that's
Stay
my
safe out
win.
there for sure.
And then I tried something new. I ordered this organic red beet root, and I put it in my drink, and it's pretty good. So that's
Nice.
my
Did you do that
new.
after we talked about it the other week?
Yeah, yep,
Yeah.
yep. So I try. That's my new food. I'm trying. It's not really food, but hey, it's powder. I don't like beets, so I was like, how can I get that in? And that's how I'm gonna do it.
Awesome.
Yeah, yeah.
Good work out of you. Who else said I'll go?
I'm Janine. I
Janine.
just got started on my supplements, and so far everything is going well. I'm only taking four kinds right yet, but no side effects. And I got my chair exercise, or I mean, my full body exercise going on this trip, and
Yes.
they're kind of slow for, I put in my age and my physical needs, and I'm going, okay, I can do more than this. But
Awesome. That's a
anyway,
good problem to have.
yeah, yeah. So I'm trying to stay in the program on this trip.
That's
So
awesome. Good for you. It's amazing. Anybody else have anything? I know what my win was. I remember now because it has to do in on my screen with the gentleman right in the middle. So I was chatting with Tucker earlier today, and man, just you were talking about some things you did, and it reminded me. And you, if you want to share it, you can. You don't have to. But gosh, you brought up one of the recipes that was in probably the elimination recipe book or one of the recipe books that you guys all have access to, and you started making that and you love it and you have it, you make enough to like, anyway, you can talk about it. But I was like,
Yeah.
oh my goodness, I
Um,
haven't had that for a very long time. So I'm going to make it this week. So go for it.
yeah. I was telling Scott earlier that I found this recipe. It's called the turkey apple breakfast hash. And if you guys haven't tried it, it's really easy to make, and it's really good. It makes a enough for like 4 or 5 meals or like breakfasts. But it's really filling and it's super good. I encourage y'all to look
Say
it
the
up
name
and go
again.
try it.
What was it called?
It it's titled the turkey apple breakfast hash.
Okay.
turkey.
And basically it's some squash, zucchini, like shredded carrots, onion, and ground turkey. But it tastes really good. So go try
Awesome.
Sounds
it.
delicious.
And apple
Yeah.
and apples.
And apple, yeah.
And apples, yeah. And I mean, it's like one of those things with recipes like that. If you can change it, tweak it, modify it to things maybe that you like, or if you want to change it up. So, man, I used to do that all the time where I would make breakfast casseroles or breakfast hashes, things like that. That would feed me for a week, let alone, but with kids and stuff, it lasts us a few days. So, yeah, encourage you guys if you haven't done things like that. Um, yeah, keep going, keep going. So good job, Tucker. Anybody else before we get started tonight? Okay, so here's my question. How many of us would love to, and it doesn't matter how old you are now, because I mean, we have, some, age is just a number, right? I always say age is just a number. So it doesn't matter how old you are, but in 5 years, in 10 years, in 20 years, in 50 years for some, do you want to be able to be active? Do you want to be able to live life without pain, physical pain, joint pain, muscle pain? Like I think I could safely say all of us would raise our hands to that, right? And say yes, absolutely. And whatever the reason is, just because nobody wants to hurt and not be able to do the things they love. So whether that's recreational activities, for those of us who have kids, to keep up with our little hooligans like me right now, like a 5, 7, and 10-year-old, like that's a lot of energy. And I want to be able to wrestle and I want to be able to play basketball with them and whatever. And then grandkids, of course, like, oh my gosh, like I'm not a grandparent yet, but I know a lot of people, some of you who are, correct me if I'm wrong, but being a grandparent is, in some people's opinions, even better than being a parent because you don't have to take the kids home with you, right?
Yep.
I see a
Yep.
thumbs up from that, but you still want to be active with them. You still want to be able to get on the floor and play with them. You still want to, just do things like that. So that's kind of the, I don't know, the why behind why I wanted to talk about this tonight, because I know this kind of stuff that we're going to talk about affects a lot of us. So let me start sharing. Okay, so joint pain, arthritis, we're going to talk a little bit. I mean, even we're going to talk about like soft tissue type pain to just kind of pain management. But specifically, oh, wait, there we go. There we go. There we go. Got it. Specifically, kind of hitting a little bit more on osteoarthritis. Guys, the arthritis umbrella is very large, right? And I'm very well aware of that. And some of us in the group here or listening have different types of arthritis, rheumatoid arthritis, psoriatic arthritis. Those are going to be more inflammatory arthritises, like autoimmune type things, which are a little different than what we're going to talk about tonight. Osteoarthritis is also known as the wear and tear, right? So it's just like the degeneration of bones and cartilage. And it's just one of those things that we all have to just live with. Anybody catch that? Do we? Do we just have to, like, yeah, it's just going to happen. It happens to everybody. So I just have to live with it. Well, not necessarily. Of course, that's why we're going to talk about it. So I have a number of sources that I got a lot of this information from: the World Health Organization, National Institute of Health. I always try to do some of those types of places. But if you guys have been listening to me for a while, I've talked about Dr. Casey Means a lot. And if you don't follow her, man, you should follow her. She's great. She's brilliant. She's a head and neck surgeon turned functional medicine type doctor. And I do have her book later on. If you haven't read her book or listened to her book, you guys all should do that. I'll have that up on a screen here in a while. But the lovely statistics. Number one is this is drastically underreported, but the statistic, according to I think the NIH or WHO or whoever, is 54 million Americans have arthritis, osteoarthritis. So just osteoarthritis, wear and tear. And I'll explain why this is drastically underreported in a minute. But the picture on the right, whether it's your knees, hands, wrists, shoulders, hips, elbows, the spine, so the neck, the lower back, ankles, and feet. I mean, osteoarthritis can affect really just so many different joints. And in a lot of people, it affects multiple of these. And so, what is the reasoning for that? So, we're going to cover some of that tonight. Now, here's a fascinating statistic: 113%, likely more actually, because again, underreported, since 1990. Why in the world would there be that huge of an increase just in the last couple decades? Does that make any sense? Like, are we working harder physically than we were back in the earlier days? I would say that we're probably, as a culture and as a world, working less hard physically because we're not out plowing the ground and carrying buckets of water and hunting, and it's an interesting statistic that osteoarthritis, the wear and tear, is increasing at a huge rate. I just find that like just fascinating. But if you start to uncover some of the whys behind this, which we're going to cover tonight, it might start making sense. So why such an increase since 1990? And I'm likely not going to get through all this tonight. This is probably going to be a two-part talk, just FYI. Um, Typical onset as far as diagnostic is in 40s to mid 50s, although osteoarthritis affects young people. And that's one of the reasons that I said it's drastically underreported. Um, whether it's athletes who sustain injuries, and oftentimes after an injury like an ACL tear, like a shoulder dislocation, I could go on with sports injuries. And a lot of you guys know that was my world for well over a decade, was working with sports injuries. I worked at a university on an athletic training and sports medicine crew. And it's like, and I myself had a really bad knee injury when I played football in college, and those kind of things lead to a rapid onset of arthritis. But not only that, in young people, a couple of you guys were around. I don't even know. It might have been this summer when I did some talks. So they're in your library, in probably the musculoskeletal folder. So if you're interested in teenagers and our young people, specifically in the cervical spine, in the neck. If you remember that talk, I've talked a lot about forward head posture and just posture in general. And our kids these days are looking down so much at phones, at tablets, they're on laptops at school all the time. It really is creating this, like, literally this epidemic, this pandemic of neck issues. And so the curve of the spine is supposed to look like a C. And what we're seeing, and I saw this with my own eyes over years and years and years of working with a lot of kids and doing x-rays on their necks, that they're actually starting to straighten out and then start to reverse curve. They're actually curving the wrong direction. Now, in a textbook, a straightening of the curvature of the neck, for example, is a form of osteoarthritis. It's stage one of osteoarthritis. So any kid that's walking around with a messed up curve in their neck because they look down all the time actually has a phase one, stage one of arthritis. It's going to get worse over time, and it's going to end up turning into, in their 20s, 30s, 40s, 50s, something that they're seeing doctors for and going to get diagnosed with osteoarthritis. So it starts very, very young, especially this day and age. And again, that's one of the reasons why since 1990 we're seeing this on such a rise. So those of you who have kids or around kids, grandkids, something to be very aware of. You gotta at least implement some sort of strategies so they're looking up more than they're looking down. So that was just I thought I'd throw that in there, but there's a lot more detail if you look back at that talk back earlier this summer. According to the World Health Organization, 60% of people living with osteoarthritis are women. Now, one of the reasons for that, a couple reasons that come to my mind. Number one, osteoporosis. Let's back up. Osteopenia is usually a prerequisite to osteoporosis, so weakening of the bones. Women are more predisposed to that just in general. So, all of you guys I know are working on vitamin D3 with K2, calcium levels we're checking. So, doing resistance training, those are the crucial things for bone health and bone strength. Okay, so that is going to help the development of osteoarthritis. Now, another reason that women, for whatever reason, how God made us anatomically different, men and women are different, generally speaking, specifically in the pelvis and hips. Okay, so obviously the reason for that is because He gave you women the miraculous job of, bearing and birthing children. So your hips are innately wider, right? So the what's called the Q angle. So the angle from the outside of your hips down to your knees is actually like a V, like this. Okay. Whereas men, it's going to be more straight up and down. Now, what in the world does that do? Well, in a very stable, strong person, it really won't impact them very much. But in our culture, especially where we sit a lot, we don't have strong, stable cores, pelvic floor muscles, and then hips and glutes, it puts a lot more stress and strain on the knees. So, a big percentage of this 60% and why women beat men in this category is knee osteoarthritis. Okay. So now I'm not going to be able to go into the details of like, how do we change or how do we do things to prevent these things. What I am going to tell you, if you have questions, of course, always ask me. But it really comes down to, I think you can do so many things proactively. And again, I can't say it enough. Proactiveness is always going to beat reactiveness. So if you already have osteoarthritis in your knees or your hips, or maybe you've even had joint replacements, because I know some of you have, it's not the end of the world. You still need to find a provider. I would encourage you to do a really good in-depth movement assessment of how your body works and is not just giving you like a cookie cutter plan, right? Because every single one of us is unique. So, for example, a month or so ago, I had Dr. Troy Getch, who's a physical therapist here in Lincoln, on. I know for a fact that if I would send someone to him, he's going to spend the time to really analyze and create a plan specifically for you and what you have going on. And that can be a strength training plan, it could be a physical therapy type plan, for whatever. So again, there's resources out there, and the reason I'm even bringing that up right now is because I've seen it for 15 plus years, and it really just irritates me that, how do I put this delicately? A lot of providers, right? So medical providers, chiropractors, even in my own past profession, but physical therapists as well, get kind of sucked into the system that we have. And the system is not individualized care. It's okay, you have knee arthritis, you're going to get this. You come into our PT clinic and you get this protocol. You have a rotator cuff issue, do these exercises. And I'm telling you, 80% of the time, I witnessed this over and over again. They weren't assessing these people thoroughly enough. They were just kind of giving them the standard plan, and it just wasn't the right plan for them. So finding the right providers and advocating for yourselves is something I encourage all of you guys to do. And you don't. Here's another myth: is you don't have to have a problem to see someone like that. Like Troy, for example, man, he's kind of like me. He would rather work with someone who's just looking to be proactive and limit the susceptibility to injuries or to things like what we're talking about tonight, than he would, having to work with you after you've already had something happen, right? So being proactive, you can find people in your area if you're not around here, and I could help you find people in your area that do that kind of work. So anyway, this is one of the reasons I knew this was going to be like a two-part talk, because man, I just talked for 15 minutes on this one slide, and I don't even know. That was just ad lib. So anyway, we'll get through what we get through. Symptoms of osteoarthritis can be very slow onset, or it could be very quick, specifically after injuries. Okay, so osteoarthritis is chronic and progressive. So, again, usually once it starts, unless something's done to stop the progression of it, it will progress. Something caused it to begin, that joint, that cartilage to start to degenerate, whether it's a poor movement pattern, whether it's a repetitive motion you're doing too much, or whether it's an injury. We have to be proactive to take care of these things. And last week, I talked a little bit about this repetitive movement disorder, also known as cumulative trauma disorder, abbreviated CTDs. So CTDs specifically account for over 50%, 56% of all workplace injuries. And that's not just like factory workers, blue collar workers, that's even office white collar workers. So we talked about the example last week of carpal tunnel, like time off of work and workers' comp cases. This is stuff I used to deal with in my practice as well. all the time. And it's frustrating, not only for business owners, to have people off work and productivity, but obviously for your personal life, because nobody wants to be in pain and have these kind of issues. And it is a billions and billions of dollars of an issue, of a problem in our workforces and, of course, our personal lives. So if you remember, I talked about this little equation. If you missed last week, you could go back and I go into more detail about this. But basically, I is the insult to a tissue or a joint. Okay. It all works together. And then you can plug in the number of repetitions, the force of each repetition. You multiply those two together, and then you divide it by the amplitude of a repetition and then the rest time. So again, if you have no idea what I'm talking about, go back to last week's talk, and you can see that we used carpal tunnel. Typing on a keyboard is a huge I. It's a huge insult to the tissues of the wrist, hand, and forearm. So over time, because there's a ton of repetitions and there's very little rest time and amplitude, so you have a huge number divided by a small number equals a big I, which is why those tissues start to get damaged over time, and you end up with something like tingly fingers, numbness, and weakness in your hand, which is no fun and oftentimes hard to get rid of. So this little diagram kind of shows the scientific pattern here. We have a movement strategy or a poor motor control issue. Like I said earlier, like a weak core, a weak pelvic floor, weak glutes. That's the kind of thing we're talking about on the far left here. That's going to lead to improper tissue loading. So for example, with the example I used of the hips and pelvis, a weak core, it strains the knees a lot and the lower back. So you're going to have an increased tissue load on those structures, lower back vertebrae, the knee joints, the hip joints, etc. So that increased tissue stress and strain, eventually, this third box here, it reaches the threshold. Your body has this resilience, this built-in resilience, that eventually it's just like, I'm tapped out. I can't handle anymore. And that's when we start to see the tissues start to break down, whether that be soft tissues like cartilage, tendons, ligaments, and then eventually the bone. So you have pain, of course, as the end result, and then soft tissue pathology or failure like rotator cuff syndromes, tendinitises, tendinopathies, Achilles issues. I mean, all the things. And then this is obviously going to lead to the osteoarthritis down the road. Okay. Anybody have any questions so far? Is this all making sense? Really, I just needed a drink of water. So, okay, cool. All right, CTDs. Again, all of these areas, the hips, the spine, the knees, the hands. My point is basically there's a lot of variables when dealing with all this kind of stuff. And I would almost put my money on every single one of us, especially on this live call right now. Like, is there anybody that doesn't have something like this? Like a knee that hurts, a hip that hurts, a spine that hurts, hands. I mean, all of us, right? All of us. So let me just tell you a quick little story because I mentioned it earlier. My senior year of college football, I had gone, playing football for 15 years and I broke my hand, I broke my foot, but like nothing like real serious. And then my senior year, I had 5 football games left in my entire football career, and I completely blew my knee up. Like just it exploded almost every ligament in my knee. And so, to this day, back then, they didn't have a great way to repair it compared to some of the innovative stuff they have now. So I don't have a couple ligaments in my knee, in my left knee. And so it's kind of gross. Sometimes I'll show people and they get kind of sickened by it. But my knee moves like the bones, like the femur and the tibia that make the knee joint. Like I can move them like about almost an inch and a half. They're not supposed to move on top of each other like when you go like this. And so it's very unstable. They told me back then that I would need a full knee replacement before I was 40 years old, probably 35 to 40 years old. And I was like, I was in college at that point. It was kind of devastating. And I was like, oh my gosh, what am I going to do? But as I learned more, as I went to grad school and really got into health and wellness, and I was always into fitness. I mean, I'm 41 and my knee, I'm doing things still to this day that most 20-year-olds don't do with their bodies. Um, and I'm not even anywhere close to needing a knee replacement. Now, am I special? No, absolutely not. Because if you actually look at my genetics, I have very, very poor genetics. I should have all the problems. My inflammatory markers in my genetics are off the charts. I mean, it's kind of crazy when I started looking at this. So what is this? What how am I able to I guess beat the system on this? It's my lifestyle, it's my nutrition, it's all the things that I try to teach and pass on to you guys, that has really made the difference for me. So even if, so my point, part of my point with that is, even if you're already in a bad place, it doesn't mean you have to stay there. I've seen things get better where people are even told by doctors, this is never going to get better. It's just going to get worse. You just have to live with it. You have to be on these pain meds for the rest of your life. Don't accept that kind of stuff. Okay. You know, there is some reality to it. My knee, I know I have to do certain things to make sure I don't injure it. And I wear a brace most of the time when I work out just for some extra stability. So there are things like that I do. But just don't always think that you're just, oh, I'm doomed. So to reiterate, one of the things that I know I had done years and years ago, and I keep a pretty good eye on myself, is how am I moving? Is because with my knees, so I'm just keep using my knees as an example, but I know a lot of us have knee issues. If it's a knee problem, is it a knee problem? Kind of a weird question. Now, something like mine, where I'm missing ligaments because they exploded and they just disintegrated. Like, yeah, there's a knee problem, but most knee problems and the stress and strain on my knee, even though there's some anatomical issues, actually usually comes from somewhere above and below. So, what do I mean by that? I mean, if I have a weak core, including weak glutes, weak pelvic floor, all of those things I've mentioned a few times, it's going to cause my mechanics to falter and it's going to put more stress and strain on my knees. So it's going to make that problem worse over time. Below, if you have foot and ankle issues, so if your ankles are really stiff, if you have flat feet or dropped arches, or if you have really high arches and you've been told that, foot and ankle issues will actually lead to a lot of knee and hip issues, and then eventually potentially even up into spinal issues. Okay, so all of these things are connected up and down. So again, that's where this movement assessment, if you find someone that can really do a thorough movement assessment and look at all of your weak links, and then you can start addressing them on your own, usually in your own workouts and your own stretching routines, then you can really make a lot of progress. Correct programs. Okay, so again, going back to what I used to do with patients and what guys like Troy does is, programming like actually workouts that are for you. And then lastly, the right care after injuries. The example I'm going to use is whiplash because it's like, who's not had whiplash? Who's never been in a car accident? Has anybody never been in a car accident? I think at some point, most of us are statistically going to be in a car accident. Now, the science on whiplash is quite fascinating because actually it's like as low as 10 miles per hour fender benders. So sometimes those little like bumps that you don't think, oh, my bumper didn't even hardly get dented. That wasn't a big deal. That kind of a force to your neck, kind of quick force, actually can set in motion whiplash disorders. So it's sometimes, and it depends on the person, but it can be pretty minor accidents. But then of course we have more severe accidents where you actually get whiplash and either immediate pain, but the crazy part is I would see patients all the time who would come in 2, 3 weeks and maybe even a month to 2 months after a car accident, and they did not have any issues or pain or headaches or anything going on until that much time out. So again, the injury, something like whiplash, can set in motion issues that are going to then give pain symptoms later on. Okay, so getting the correct care. So I would really encourage you guys, if you have family members or friends who they're in any kind of an accident, they slip off of a curb and they fall. I mean, it could be, I'm just using car accidents as an example, any kind of slip, trip, fall, car accident. it's always worth getting checked out by someone reputable and good, and then getting some sort of a program in place to prevent anything from happening. Because like I said, with the kids, like looking down all day, straightening of the spine, of the curve of the neck, sets in motion this arthritic change over time. That's exactly what whiplash does. So that whiplash motion injures some of the soft tissues, but it actually injures some of the mechanics of the joints of the neck, and will lead to usually straightening of the spine and degeneration down the road. So after whiplash. Okay. Any questions with that? I know I just covered a lot there. Anybody have any questions? All right. So everything I just talked about, which we're almost done now, is not even what I wanted to talk about tonight. So the point here is most of what I just talked about is actually still ignored in our healthcare system. Like prevention is hardly talked about. Proper mechanics is hardly ever talked about. Like, when's the last time anyone, whether you went to a physical therapist or maybe a personal trainer at a gym, and they did like a full body movement assessment? They checked how strong your core was. They checked if you were breathing properly, because that has a lot to do with core stability. It just doesn't happen. So this whole piece, number one, is being ignored. Okay, so I encourage you all to think about this. But then the next piece, which is the big topic that I want to talk about, is even more ignored. And it's not talked about hardly at all. What is that? Metabolic health and joints. So we've been on this whole journey of what metabolic health is and how it impacts so many things. And yes, it does impact our joints and our soft tissues just as much as it impacts, what all the other things we've talked about in your health. Okay. So some things I'll cover tonight, but then into next week. Is how arthritis is not just a structural issue. So it's not just this wear and tear thing that we've always been told. It's a biological issue as well, tied into how our metabolic health is, which we know you can improve both of these things. This is where I always say, don't lose hope. There are answers. Even if you're in a rut, uh, you can improve structure. You can improve, I shouldn't say you can improve structure. Sometimes you can improve structure, but you can improve movement patterns. You can improve your resilience, and you can improve your metabolic health. Okay, so then expanding or thinking about surgery. I'm going to talk a little bit about surgery at the end, probably next week. So I'll skip that for now. Dietary changes, supplements that can help your joints. So again, some things that a lot of you are already doing, but I'll have some more ideas for you when we get to that part. So just things to think about. And then how the mind-body connection impacts joint pain as well. So here's the summary. What we thought versus what we're learning and what we know now. So what we always thought osteoarthritis was wear and tear, this cumulative kind of injury trauma cycle force that leads to this bone degeneration, cartilage degeneration. But what we now know is that is still a part of it. So you still see wear and tear and injury and cumulative force kind of down towards the bottom. But there's metabolic syndrome, there's lipid abnormalities, there's obesity related inflammation in general. You don't have to have obesity. This diagram just says that. Increased weight, uric acid levels that are off the charts, et cetera, et cetera, et cetera. So I would throw in here blood sugar and insulin resistance, because we know that's going to be lumped in with metabolic syndrome. Okay. So anyway, here's what I was referring to earlier. If you guys have not read or listened audiobook to this book, Good Energy, I would highly encourage it. Dr. Casey Means, medical doctor, she's fantastic, just a wealth of knowledge. So in this book, she actually talks about this subject, where I pulled some of this information, some of the stats from, because she actually had a really bad knee injury as well, and went to, so she's a doctor, right? She's a medical doctor, so has a lot of colleagues. Went to oh, some fancy schmancy orthopedic surgeon that's, known to the stars, or I don't know who it was. And they were telling her she needed to have this big procedure done, and she was kind of hesitant to do it. So she went to some other friends of hers, some other orthopedic specialists that were more holistic in their thinking, and they actually encouraged the opposite. They encouraged her to do everything that we're talking about tonight. Physical activity, movement assessments, strength training, making the knee more resilient. And so that's what she ended up doing and taking that course of action. And basically her summary was, it's amazing what our bodies can do if we give them the right tools to be able to do it. So, okay. So anyway, that quote you can read there, and it's a great book. So anyway, just kind of a side note there. All right, for the last couple minutes, just kind of laying some framework, and then next week we'll finish out. So our joint. So this would be a knee joint. Okay, so you have the bones, right? The femur and the tibia and the fibula are the main bones, and the kneecap, which is called the patella. You have cartilage, so in between the bones in the middle there. A lot of us know those. Those are the meniscus. So meniscus tears and meniscus degeneration is a dime a dozen. You also have the ligaments on the outside and the inside that provide stability. And then, of course, you have tendons of all the muscles that attach to and move and stabilize all these bones. Okay. So the cartilage is obviously the cushion to dampen forces and provide sliding and gliding movements. And tendons, like I already said, the tissues, they all work together to support the joints. Okay. Um, the second one there, oops, what did I just do? Hit the wrong button. So osteoarthritis should be considered a metabolic disease where the tissue's ability to make and use energy is impaired. What the heck does that mean? So chronic inflammation. We talk about inflammation all the time. In your blood work, we look at inflammatory markers like CRP, homocysteine, things like that. Blood flow problems, mitochondrial dysfunction. So the mitochondria again are the energy producing parts of our cells. And then dysregulated blood sugar levels and insulin issues are obviously culprits to heightened inflammation in our body. Okay. So, and then of course, you always got to throw this in there because anybody overweight slash obesity, the statistics are just alarming. I mean, you have 5 times of a higher risk for both metabolic syndrome and osteoarthritis, just as an example. Okay. So we obviously want to get weight under control, and that has a lot to do with metabolic health and all the things we're talking about. So now the last 5 minutes, I'm going to go into this diagram, and I'm going to talk about macrophages, T lymphocytes, B lymphocytes, mast cells. I'm kidding. I'm not going to talk about any of that stuff. this is a complicated thing about the biochemistry and biology of our body. Okay, so it's fascinating science how this all is, but we're not going to go that deep. We're going to focus on this little part right here, which is simply what do they call this? The circulus viciosus. Is that Latin for vicious cycle? So, or vicious circle. Okay. And so it's kind of just everything we've talked about. So anytime you have damage done, inflammation is heightened. There's all sorts of inflammatory mediators, and it's just like this cycle just keeps going round and round and round unless you put things in place that are going to stop the cycle. Okay, so proper movement, proper strength, proper vitamins, nutrients, and minerals, all the things. Okay. And this is just, I don't know, if you couldn't see the last one, I just wanted to give this, because I like this diagram. So if you wanted to check it out in a bigger picture, there it is. All right, we'll probably just do this one last slide. What does high blood sugar levels have to do with any of this? So inside of tendons, so this is a tendon. So you see the pink or red part is the muscle, and then the white part is the tendon, which attaches to a bone. I'm sure almost everybody has had like tendonitis, just issues like that. what can happen is when you have high blood sugar levels, it damages the collagen proteins inside of these tendons. Okay, so that's not good. So when force or stress is applied to the fibers, they cannot slide and glide like they're supposed to, and they basically kink up, and then they start to get damaged. So the fancy terminology here is called advanced glycation end products, or AGEs. So these AGEs, it's kind of like, think about sugar molecules that are just sticking to the collagen proteins and making them sticky and kink all together and kind of clump up, instead of being able to slide and glide and work like they're supposed to. And that causes stiffening over time as well, which is going to cause more susceptibility to injury. And this usually is a process that's going on for a long time. And so recent research actually indicates that this process we just talked about with these AGEs causes degeneration in tendons like the rotator cuff. So, how many of you know someone who's had rotator cuff issues or surgeries? Man, I'll tell you, gosh, the shoulder is the most complicated joint in the body by far, like by a million. I've worked on a lot of shoulders over the years. I have a kind of a bad shoulder myself. And I'll tell you, surgery sometimes necessary, needed, but anything that you can do to not have shoulder surgery, I would always tell people that. And so if you know anybody else that's struggling and they're trying to decide what to do, man, do everything you can before you go down that road. It can go wonderfully, but so many people still struggle after a shoulder surgery. But this is basically showing us one of the things is like rotator cuff tendons, like the main one that tears that people have to have repaired is called the supraspinatus. It's kind of the one right on top here that you get this like sharp pain when you lift your shoulder. Um, we think of it as, most commonly, you reach out and you pick something up, and that's when you hear a pop and it tears. That didn't just happen. This is a cumulative trauma disorder, repetitive poor posture. So, again, the structural part is poor posture, leads into that tendon being kind of susceptible. And then you throw something like this in there. Is that person living an unhealthy lifestyle? Are they not eating the right food? Are they not getting the right nutrients? Are their blood sugar levels all out of whack? They're kind of just setting themselves up for a rotator cuff issue or a knee issue, or whatever it may be. So anyway, I'm out of time tonight, guys, but we'll continue this on. I have a few more things for you and some good stuff as far as like, okay, what do you do about all this, probably next week. So anyway, if it's time for bed, head to bed. Otherwise, does anybody have any questions or comments on this so far tonight?
Good information.
Good information. Okay, good. I was actually just thinking, thank you for saying that. Um, I've asked this question before, is I always just want to make sure I'm giving you guys, good info and things that you're taking and being able to use. And since nobody told me, the last two times I've asked, nobody said, hey, can you talk about this subject? I'm just coming up with stuff. So is this valuable information for you guys? Yeah,
Yep.
okay, enjoying it. Okay, good. I hope so. I really think so. I mean, I try to choose all these topics, and because I could talk about so many millions of things. Um, this is just something that, man, and arthritis, but also just all of the pain, people that are in chronic pain. I mean, I've dealt with it for over 15 years in my career, hands on. You guys mostly know that I worked as a chiropractor and kind of PT type guy. And man, it just got so frustrating when I would fix somebody with something, but then they'd be back with the next thing or re-injuring that same thing. And it's like, over time, I'm like, why does this keep happening? I was addressing the structural components only. And that's the transition in my career, is why over time I'm like, I got to do more for people. The structural part is, there's so many people that do that, but nobody's paying attention to this functional medicine, this metabolic health, like what else is going on in these types of things. So anyway, that's the passion. That's the why behind kind of why I'm telling you guys all this stuff. So I hope you take it and can utilize it somehow in your life. And then always here for questions. So if you don't want to shout them out now, just chat message me. Okay. All right, y'all. Have a great night. Enjoy the cold
Thank you.
weather. Bye.
Good night.
Thank you.